Major drug maker has now basically announced the price of their course of treatment for the coronavirus. And it turns out that it's not cheap. According to the Associated Press, Gilead Sciences on Monday announced the price for the drug remdesivir. And as I mentioned before, it's pretty expensive. Now, this drug has actually been shown to shorten recovery time for seriously ill COVID-19 patients. And so it doesn't really help the death, reduce the death toll of the virus, but it does help people recover a little bit faster. So now the price for this drug, if you have insurance, is $3,120 or $250 a dose. Wow. So now, of course, they mentioned that, well, I mean, the amount that patients will pay out of pocket, well, it depends on your insurance, depends on your income and other factors. I think some of those other factors, of course, include how they should get away with highway robbery amid a pandemic that's killed 500,000 people globally. But that's just me. And they might want to think about that for a bit. I'm just saying, right? So now Dan O'Day, who is Gilead's chief executive, he said this, quote, "We're in uncharted territory with pricing a new medicine, a novel medicine, in a pandemic. We believe that we really had to deviate from the normal circumstances and price the drug to ensure wide access rather than based solely on value to patients." Wide access, guys. Wide access. You know what? Access is the all lives matter of healthcare. That's what that is. Oh, we're going to ensure access the same way that all lives matter. Whenever somebody talks about, hey, let's make medication free to people, we'll have the government pay for it through single payer, and allow the government to negotiate drug prices, they say, oh, no, we're just going to increase access. We're not going to do that radical stuff. That would actually make it affordable. No, we're just going to make it wider access. Oh, I'm sure that'll be a relief to have the access to this medication if you're one of the unlucky few who still has their insurance, or maybe the 40 million people currently out of work that have lost their employer-sponsored insurance. Well, they're screwed. They're screwed. Now, the treatment courses that the company has donated to the U.S., by the way, according to O'Day, and the other countries will run out in about a week. And then he says the prices will apply afterwards. So understand that they're like, we're just going to give the government a bunch of remdesivir and other countries. And then, as soon as it's shown to be somewhat effective, at least in reducing times that people, recovery times, then we're going to hike the price to $3,120 for a full course. Great. And they're doing that because they want to make a profit. And look, here's the thing. Okay. This medication was heavily subsidized by the American taxpayer. So we already paid for that drug. We invested $70 million into the development of this drug. $70 million. And yet this company is going to turn around and charge us again. I mean, yes, they're going to charge the insurance companies that are going to pass down some of the price to us. Now, so some people, if they have good insurance, might pay a small copay, might not pay a copay at all. Who knows? It depends on your insurance. But at the same time, if you don't have insurance, well, we don't know what's going to happen. I'm sure they'll come out later and be like, oh, no, we got a program where you don't have to pay that much if you have no insurance. But somebody's going to pay because, of course, they're going to get their, pound of flesh, right? They're going to get their money. They're going to get their money, and they're going to be able to pay their executives with it because that's what they do. And so I think it's bullshit that they have can get away with charging people for this medication because, look, in America, I mean, it's really amazing. In this country, we have decided as a country that for some reason we cannot limit the profits of certain corporations, like health insurance companies and pharmaceutical companies. I mean, even though the vast majority of the American people knows we're getting ripped off, they know we're getting ripped off, and they're like, hey, we should do something about this. And yet Congress, they don't do anything about this. They're like, oh, no, it's fine. Working as intended. We're not going to really do anything. I mean, even bills like that President Trump says he's in favor of that will limit price gouging, right, during a pandemic, still can't pass. And there's a reason for that. Of course, it's corporate lobbying. That's what that is. Corporate lobbying, corruption. It's the corruption. It's the corruption. And so it's just, again, amazing, right, that they're allowing this to continue happening. And what sucks is that, again, you've got people who are risking their lives the most, right? You've got essential workers, grocery store cashiers, gas station attendants. Those are the ones that don't have good employer-sponsored insurance. They don't have any insurance, right? They're the ones that are most at risk, that are going to most need whatever drugs come out. And yes, I realize that this, isn't an effective treatment for coronavirus, but is, one of those things that shortens your recovery time. And so it does help. It has helpful properties, and certainly something that if you do have serious symptoms that you should be able to take and should be able to have. But like, think about anything else that they come up, any sort of really groundbreaking treatment for coronavirus. What are they going to do there? Are they going to be like, oh no, profit motives? Oh, we don't need that. We're just going to distribute it everyone to everyone for free, because we care about protecting Americans, American citizens from this terrible virus. Is that going to happen? Very unlikely. Again, I know America, right? And so you're going to have people that don't have insurance, that don't have any sort of coverage, that are in the front lines, that are not going to be able to get this. And they're the ones who are going to die. And ironically, they're also going to continue this cycle of people getting sick from this virus. So you've got two viruses in this country, essentially: corporate greed and coronavirus. And one is feeding, actually, they're both feeding off each other. And it's disastrous. And so, you know what? Interesting fact here. Other countries, right? Gilead, right? In the article, they said, well, generic drug makers, Gilead has allowed them to supply 4 courses of treatment to 127 different countries, right? These are generic drug makers. You know how much they charge for that? For a whole course? $600. Are they allowing that in America? No, they're not allowing the generic here in America. And so American citizens, even with insurance, have to pay $3,000 for this, whereas other countries, $600 for a whole course. Why can't we do that here? Because we don't have a single payer system. In every other country where they're allowed to do this, they have a single payer system or some sort of universal healthcare system, right, that allows the government to negotiate drug prices with the drug manufacturers. We do not have that in the country, and that's why we're paying so much more, not just for this, but so much more for every medication. And by the way, the medications that are being gouged the most, I mean, you have insulin, for example, that's very, very cheap to make. This drug, you know how much it costs to make? $10. That's how much it costs to manufacture this medication. No, it should all be free. It should all be free. It's amazing. So now there was obviously some outrage, right? Dr. Stephen Nissen of the Cleveland Clinic told the Associated Press in an email that, quote, this is a high price for a drug that has not even been shown to reduce mortality. Given the serious nature of this pandemic, I would prefer the government take over production and distribution of the drug and distribute it for free. It was developed using significant taxpayer funding. You also have Peter May Bardick, a lawyer at the consumer group Public Citizen, saying that this is an outrage. Quote, this is a drug that received at least $70 million in public funding towards its development. Remdesivir should be in the public domain. And I agree 100%. I don't give a damn about profit margins. I don't care. It's a pandemic. This is about lives. And it's about time we stop putting profits over people. and rein in the absolutely disgusting greed and extortion of these companies. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a patreon.com/TYTNation set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.